Scientists compared the DNA of 100,000 cancer patients with the same number of healthy people. They found 80 genetic variations, single-letter differences among the billions in our DNA that kept coming up among the cancer patients. For breast cancer, the 49 new markers more than doubles the number scientists had already identified. There were also new markers found for prostate and ovarian cancer. So what does this mean? Well, for breast cancer, the average lifetime risk for women is 1 in 8. But this test can identify the 1% of women who carry lots of genetic markers. Their risk can be as high as 1 in 3. The flip side is it can also indicate those who've inherited a very low risk. For prostate cancer, the lifetime risk for men is also 1 in 8. But if you're among the 1% of the population who inherit the worst DNA faults, it can rise to 1 in 2. That could make a huge difference to men like Jonathan, a retired doctor. A gene test could have revealed he was at high risk decades ago. His prostate cancer was eventually picked up by a biopsy.
I must say I was extremely surprised and shocked because I was sure that I hadn't got the disease. Luckily it wasn't very malignant.
These are the gene chips in Cambridge which analysed the DNA from blood samples. Within a few years, the same test should be available using saliva, and scientists believe it will be cheap enough to be offered by the NHS.
We're really going to realistically enter the era of personalised medicine. We won't treat people based on whether they fit into a box of a certain population. We'll base treatments and screening types of programmes on their individual levels of risk.
Scientists are using the same approach to look for the inherited risk factors for bowel and lung cancer, and that information will also yield new targets for cancer treatments. Of course, our DNA only gives us part of the picture. Nearly half of all cancers are linked to our lifestyle, so the way we live is often more important than the genetic deck of cards our parents gave us.